So let's look at a few scenarios where preceptors are working with learners.
I hurt my wrist playing tennis, and all I want to do is to see my family doctor.
All right. And I promise you will see your family doctor. She's just right outside. But today we're splitting up the work, trying to get through things a little bit more efficiently. So if it's all right with you, I just want to ask you a few questions first. Just find out some more history so we can kind of whittle the story down so that when she comes in here, we can go through it kind of a little bit quicker and just get to the bottom of it.
That was good.
That was good. Let's look at another.
Doctor, it's my back, my lower back. Oh, God, it hurts. My leg, down this leg. It's just Tylenol. I've tried Tylenol. It's not working. So I'm here to get some kind of help.
Okay. So when did this start?
Well, it was last week, and I fell off my bike.
Okay.
And ever since, it just seems to be getting worse.
Okay.
And there's like pain in my calf.
Okay.
And
What does the pain feel like?
Okay, good job.
Okay, good job. Let's look at one more.
doctor, my back is killing me. And the pain, it's lowered back, and then the pain goes in down here, my leg and the calf.
Okay.
And I hurt myself about 4 days ago, Thursday, I think.
Okay.
And it's hurting ever since.
Is it getting worse?
I think so. Like I tried Tylenol, it's not working.
Okay.
And I can't garden. I can hardly walk around you.
Okay.
So it's really interfering with my life. Oh.
Okay. Has this ever happened before?
No. It was a bike. I fell off my bike actually, and that's what really got me. Yeah.
Okay, good job.
Okay.
Okay, good job there too. I wonder if Leslie has anything to say about these feedback scenarios. Leslie?
So this scenario is a very nice example of a common pitfall of giving feedback. And that's a scenario where a preceptor is observing a competent learner do something and it basically looks okay. And so the preceptor thinks, well, there's no big deal there. Basically it's okay. And so they feed the learner compliments by saying, nice job, thank you, that was great. But what I want preceptors to reflect on is that teaching a learner involves giving them some specific information about how to improve their performance or even reinforce the things that they are doing well.
I see. Again, the goal of feedback is to give the learner information to reinforce or improve their performance. So dealing with learners who are doing something well, we should at least label what behaviors they are doing that are good, and then give some specific information about those behaviors to help reinforce them. Is that right?
So a definition of feedback is information that the learner can use to reinforce or improve their performance. So when we're dealing with a learner who basically is doing something well, we should at least label what behaviors they're doing that is good and that are good, and then give them some specific information about those behaviors to reinforce them.
Exactly. She took the words right out of my mouth. Do you have any other thoughts about giving empty feedback?
So another common pitfall that preceptors fall into when they're providing feedback to competent learners is not pushing the learner beyond their zone of comfort. So again, we're watching a learner and basically they're performing at a level that we think is appropriate. But we could always push them to another level. Remember, everybody's performance can be improved. So let's take an example like history taking. For a medical student, we might be observing the structure of their history and the questions that they ask around the disease. Whereas maybe a resident, we're looking at their communication skills, how effective they are in managing their time in the history. And maybe a senior resident, we're looking at whether they can use the history to explore other issues like psychosocial issues. And so the preceptor should reflect on, when they're observing a learner, how could they really improve their performance? What is the next level that that learner could go to? And we should be pushing all our learners to improve.
I get it. We all can improve. The overall goal of all of this is to help the learner become the best physician they can be.
Cut. One more time. Action.
I get it. We all can improve. The overall goal of all of this is to help the learner become the best physician they can be. A great side effect to all of this process is that we too can learn and become better preceptors and clinicians.
Cut. Great job.